Think your nose looks crooked? Today, Beverly Hills-based Dr. Vranis explains what makes crooked nose rhinoplasty look beautiful or not. Stick to the end to learn why a nose made straight by rhinoplasty can still look crooked. Dr. Vranis, when patients say their nose looks crooked, what are they seeing?
Well, first of all, thanks for having me back again. I really appreciate it. And I enjoyed our conversation last time. I would say that that's a tough question because the tip can be crooked in relation to their lips, their eyes, or to the top half of their nose. So crooked, I think, means usually there's a discrepancy, there's a deviation, there's one part is a little bit off compared to something else. Now, the question is identifying what that something else is. And I think that's where you have to guide patients and realize or talk to them and say, okay, tell me, what do you mean by crooked or what do you see? And then together you will analyze the different features of the face. And then you'll start to point out these, oh, it's crooked. The tip is crooked in relation to the dorsum. Or, of course, the obvious ones are when, like, you get punched in the face and then your nose is crooked because it's an obvious C or S shaped deformity. Those are obvious. But the more challenging ones I think we're going to allude to and hint to, discuss and review a little later is those more nuanced crookedness, deviate, not necessarily the deviated nose, but the crooked based on a relationship to another facial feature.
Yes, my son, rugby player, crooked nose, deviated everything. Okay, that makes sense. During a consult, would it be beautiful or not to bring celebrity pics to show to a surgeon?
Super helpful. It does tell us that we're in alignment. So basically, if someone says, "Hey, I want a really, really straight nose at the end of the day," and then you say, "Oh, show me 3 photos," and they show you these like tiny, complete ski slope noses, you all of a sudden red flags have to go up and say, like, "Wait, hold on here. Are To me, this looks like a ski slope nose. Is this look like a straight nose to you or a ski slope nose?" And then you can kind of figure out what they mean by a straight nose or what they really, really want. So it's very helpful in that regard. Now, in the part where it's not helpful is that a lot of celebrity noses are highly filtered. They have 4 hours of makeup to contour their nose in a certain way that's just not realistic from a surgical outcome. So, from that standpoint, it's not helpful. But it is actually helpful in terms of having that conversation. It opens up the door and you say, "Oh, well, did you realize that the celebrity photo shoot went through 6 hours of hair and makeup? The lighting, there's like 12 lights on every angle to make sure they get the one picture where that nose and the other facial features look incredible." And so people then start to realize, like, oh, this isn't actually like something the way they walk around.
Ski slope nose, is that ski slope?
That's usually what people call the ski slope. So think of it when you're watching the Winter Olympics and they're going down the hill and they go up that pipe to then go do their tricks and flips. So that's usually when in the side profile, when people want a very scooped out nose or a ski slope nose, that's usually the keywords that they'll say.
Beautiful or not, planning a rhinoplasty to straighten the look of a nose by focusing 100% on the nose.
Oh, that's the first mistake. And a lot of people get tricked online in pictures and before and afters when it's just the nose. That's all you can see, and it might be a beautiful nose in isolation, but then when you look at it, it compares to or how it fits into the rest of the face. There's a lot of things that can fall short. So be careful if all you're seeing is pictures of like close-ups of like just the nose. You want to make sure you want to, or my philosophy at least is to make a nose that fits into your ethnic congruency, your ethnicity, your facial features, all that stuff kind of comes together in my mind as an artist and when you're trying to create a nose.
Beautiful or not, planning a correction based mostly on imagery of the front view of the nose.
That's impossible. So noses are a three-dimensional part, and so or three-dimensional structure. And in fact, in this is one of the hardest things of rhinoplasty is that when you make one change in one dimension, you're almost guaranteed to change it a different direction from a different viewpoint. And so you always have to consider it's like a game of chess when you're in there doing a rhinoplasty. You move and position the cartilage a certain way, but you have to, after every move, look at all three dimensions: the front, the side, the bottom view, and then say, okay, do I like it? Okay, I'll take it. Or you make an adjustment and you say, you look again, front, side, underneath, and you say, oh, it needs a little more change. You change it again, and then you look and when you're happy with all three views, that's when you like suture it in place and make it kind of stick there. So that's the hard part. And so you can never analyze a nose just on one view, whether it's just the front, whether it's just the side, or just the bottom. You kind of need, in an ideal world, have all three work in harmony together.
During surgery, would it be beautiful or not to strive to move the nose closer to the center of the face?
Definitely. So yeah, I think there's, inherently as humans, when we see a symmetric face, we do subjectively judge it as being more beautiful, in quotation marks. Um, it's something that I think even as young kids, when we see symmetry in faces, it makes us smile, it makes us happy. It's I think a sign, a very naive way of thinking of health. A healthy face is a symmetric face. If you start to go into congenital disorders and birth defects and things like that, it starts deviating from a completely symmetric face. And so that's, I think, just in the back of our mind, where it's imprinted as we're growing up and even as we're born as like newborns, to look for things like that. Now, perfect symmetry is never, ever, ever achievable or attainable. Everyone's going to be a little asymmetric. And that app that was very popular, that little game that was like, I don't think it was called face tuning or something else, but you basically take a picture of yourself, and then in the app, it chops up your face directly in the middle, and then it does a mirror image of the left side and a mirror image of the right side. And then you look at these two pictures and you say, wow, these are two different humans. And so basically what it does is it really shows you just how different one side of your face is compared to the other, or it magnifies those little asymmetries. And because now you're seeing like two right sides and two left sides, then all of a sudden you can start to appreciate and say, wow, okay, the two sides of the face really are quite different. So, perfect symmetry, not possible. I think trying to get towards more symmetry is, I think, the goal. And I think this is what does make faces just look more beautiful after a good rhinoplasty. Or, when you post something and all the comments say, oh, wow, what a beautiful result. Oh, she looks more beautiful. She looks more rested. What a great result. It looks natural. It fits, things like that. I think people's minds are telling them that we're a little closer towards being symmetric.
I didn't really realize that we were just, kind of programmed to love symmetry.
Yeah. I think it goes back to biology, like if you think about it, it's all about biology and passing genetics. And so a more, symmetric, more beautiful, more healthy person is someone that you'd want to mate with to create, more babies that are also, symmetric and beautiful and healthy.
That makes sense. It's just primal.
Right. It's primal instinct. I think a lot of life we do is just driven by primal instinct.
Yeah, exactly.
Have you ever, out of curiosity, have you ever done that app game that I was describing?
I've not heard it. I thought you were going to talk about a different game where it blows out your nose or makes your cheeks, it makes you look different. But I'm going to look for that, especially if I can find my twin maybe that way, my twin.
Yeah. That might be an interesting way to put the segue or the picture.
I love that. That would be fun. I'm going to look for
Yeah.
that. Okay. Is it beautiful or not for a surgeon to correct the inside support structure of a crooked nose without changing the outside?
It's very difficult to change the inside without having any sort of external or exterior changes. Can it be done? Sure, especially when we're dealing with breathing problems like an isolated septoplasty, which is very deep inside. To correct breathing, that's easy to do. The next level up, or the next issue with breathing, in addition to severe septal deviations that affect airflow, is that you have internal valve collapse. So when you breathe in, this internal valve collapses in, and then it doesn't let air go through that side. And so what we'll typically do is take a little piece of cartilage from the septum, slide it into the internal valve to make it a little bit stronger and a little kick it out a little bit more. And that way then when you breathe in, it doesn't come in as much and it gives allows a lot more airflow to come in through that nose. But even in doing so, you do widen the nose a little bit. I mean, if we're going to be very, perceptive of it, it's not much. People still look very normal, very beautiful. It can be done. It's just that it does widen it a hair.
Is that what causes like drainage after? I saw a video today of someone who said, if you get a rhinoplasty, your nose is going to drip all the time. And she was sniffling and
No, that's actually one of these things where not everybody gets it. Some patients get it. Some patients, it's tough to predict who's going to get in. There's different etiologies of it. One is that if you think about it, any sort of surgery will disrupt the little nerve sensations that live in the mucosa. And so if they don't kind of wake up in time, or they stay numb, that basically they don't allow the body, the brain, to understand how much humidity is in the nose, and so the brain will then just overproduce mucosa, in which case then it run or mucus, that way then it kind of runs out and you have a runny nose. The other thing that can happen is you could affect some of the sinus passageways that drain into the nose and kind of just reroute the way they flow. Usually they kind of drain into the nose and then go to the back of your throat. You swallow them, never comes out from the front unless you're sick. And, during that time you have overflow and then you start getting the sniffles or you need tissues, things like that. So it does, some rhinoplasties, it depends where the work was done deep inside the nose, I think can affect some postnasal drip, and so that becomes uncomfortable, irritating, and a little socially awkward if your nose is always running and every 10 minutes you have to kind of get a tissue to wipe it. It's a little bit, it can be a little bit socially difficult to deal with.
yeah, that's not fun. So does that go away?
You can almost guarantee the first couple months, but while those nerves are waking up, that you're going to have some sort of either dryness or overproduction of mucus. So that is the temporary part of it is pretty normal. I think when it starts exceeding probably 6, 9 months, 12 months, and it's a little bit more permanent or semi-permanent, then it becomes more problematic. Um, I haven't yet, I've knock on wood, I don't think any of my patients have yet to have that, but I have seen a couple patients and it's really tough to fix. There are different nerve ablative measures that can be done, where you basically cryotherapy some of the deep nerves to basically calm them down, that so you don't get that overdrive overstimulation of mucus production. It can help. I don't think it's a guarantee, but it could be worth a try, especially if it's very distressing for patients.
Post surgery, beautiful or not, tiny curves, minor asymmetries that still exist after rhinoplasty.
So I think we're entering an era actually where people want more natural. And again, going back to our earlier conversation about asymmetries, is that a minor asymmetry actually makes it more imperfect, and right, and then some people find beauty in these imperfections. And so I've had a couple patients kind of come and say, like, I want to leave a little residual bump, or I want to have a little bit of an asymmetry, so that it just continues to look more natural versus it being a very robotic, very perfectly symmetric nose. And I think we're just seeing a little bit of a shift in society now, that the patients are accepting of it and some of them are even desiring it. So I think it is beautiful to have it. I think if, rhinoplasty is a very difficult operation, and if there is an inadvertent imperfection, a lot of these things can be taken care of in the office. So if it is distressing to patients, if they say, I love everything except everything about this rhinoplasty except this one little thing, a lot of those things can be kind of taken care of very easily in the office. So trust the surgeons that you go to, go back to them, talk to them, and be honest and say, listen, I think this is an A minus, but if we did this, it would, in my mind, go to an A plus result. Can we do it? And it might involve just a tiny more rasping. It might involve a tiny little cartilage graft in the corner, something like that. And all of a sudden, like, the patients are thrilled, the surgeon's super happy afterward, and it wasn't a big deal whatsoever.
Can you address little asymmetries, maybe move from the A minus to the A plus without surgery?
So surgery is like a word that means like any sort of procedure. So technically it would be a small surgery, but it would be a little procedure under local in the office, takes 20 minutes. I mean, these minor things. I'm not talking about like, make a whole nother surgery day out of it, come to the operating room, go to sleep, just to address all the little things. So most little touch-ups and tweaks can be done in the office very comfortably, probably in under 20 minutes. Under just local anesthesia. Like you go to the dentist, they put a little numbing shot so you don't feel anything. You wait for the 20 minute for, that numbing to kick in. It takes like a couple minutes to do it. And then you either like one stitch or sometimes you don't even need a stitch and you walk out, you have a little bit of swelling, bruising for the next couple of weeks, days or weeks, and then you're, back to normal.
Perfect. Great. It's amazing. It's a miracle.
Well, I think one of the comparisons that we kind of talk about it oftentimes in the office is that it's kind of like you're building a house and you build this, you build the garage, you build the kitchen, you remodel six bathrooms, you have like, brand new roofs and AC units. And then at the end, and then it's time to move in and you say, I hate the garage color. And so all that means is that you don't have to redo the house. You don't have to break everything down to rebuild it. You just say, okay, let's order some paint. And then, next weekend, we're going to sit there and paint the garage a different color. And now all of a sudden I'm thrilled. It's the same thing.
Can you tell us about one of your cases where there was a severe deviation and how you dealt with it?
So this case actually comes to mind. It's near and dear to my heart. I many years ago operated on a woman, and she, 5 years later, reaches out to me and says, "Hey, my son has an issue. He had breathing, deviated septum, breathing, disturbance. He went to a surgeon out on the, East Coast near them, and now all of a sudden the breathing's way worse. Is there any chance you could please see him?" And I absolutely adore this woman. I had to operate on her. She trusted me, and now it's like the next level of trust is to trust you with her son. And so they're from the East Coast. And and the irony actually is that he's in college, and he actually is in college here, like 2 hours away from LA. So for him, it was easy. She flies across the country. I look in his nose, and the one side on the inside is completely to the left side of the nose, like like complete obstruction. I'd never seen such a bad inside of a nose before. And we talked about it. And I said, listen, like, this is going to probably require like a complete reconstruction of the septum. It's not easy to do. I'll definitely need a little bit of your own rib to do this, and let's do it. And so they thought about it. And they said, all right, let's go. So he's on his spring break. We had like a narrow window to schedule this surgery, this revision surgery on, and we do it. And when I opened it up, the whole septum somehow was like complete. It was like a right turn. It was like a complete obstruction of the airflow. And so take out the entire septum, rebuild it, put it back in, and use like his rib to add strength. And so one of the principles here is that, if you do the same operation twice when expecting different results, you're crazy. So I had to think of something different, something that the first surgeon didn't do, did incorrectly, or just, missed. And so one of the things in my mind was to just, add a good amount of strong cartilage for reinforcement. And so did that. A week later, we take out the splints. He takes a deep breath and he starts crying. He's like, "Oh my God, I haven't like breathed this well in like years." And we took the opportunity to address a couple other cosmetic concerns on the outside that were pretty minor. Especially as a guy, you usually don't want something. And he's like a normal college dude. He just wanted like a little bit of a like straightening, a little bit of like the tip being a little bit more refined, but nothing crazy. And kind of, I guess, nailed it. And he was so thrilled. Took out the splints, the cast on the top, and he started crying. And it was just like he could breathe well. And then, I saw him a year later, and he's dyed his hair blonde. He's like living his best life. He's, put on like 10 pounds of muscle. He's like just completely changed. He's like a whole new person, and so confident. Comes in the second time for his follow up, with his girlfriend, and it was just like really, really nice to see. Like one, he got confidence. Two, he could breathe again, and I mean that was like one of the coolest, most rewarding things I could see. And then three was just the whole story of like, the mom trusted me with their little kid, her little boy. And I take that very, very seriously, and it's very meaningful when patients, send their family, for surgery.
Okay, so that brings us to our question we've been waiting for. Is it possible for a nose to become technically straighter after surgery and still look crooked?
So I've seen this a couple times. It's not common, but it is one of these trap doors that if you fall into it, in retrospect, you want to kick yourself in the butt. And basically, it's in patients where we've talked about asymmetry from right to left. What I want to kind of talk about is discrepancy from top to bottom. So if you were to put a dot right between your eyes, so that's the middle of the top of the nose, but it's the middle of kind of the bony structure of the orbits where the eyes are. And then you put a dot right in the middle of your lip, which would be kind of the middle part of the jawbone and the maxilla. Ideally, and in most people, those two dots are actually pretty straight. And so the nose that lives in the middle of those two dots, if it's straight, then it's also going to be straight relative to the face. Now, there's some people where their eyes are shifted a little to the right and their jaw is shifted a little to the left. And so when you make those dots, they're no longer straight, but they're like this. And usually what happens is that the nose itself is a little deviated to eat up the difference. And so if you look at just the nose and you straighten it, then it's going to look really off centered to the lip. Or if you straighten it the other direction, it's going to look really off center to the eyes. And so that's where you have to really be careful. And if you notice it, I mean, the first time I did it, I scratched my head. I was like, I don't get it. The nose is straight, but it looks off. And like, the patient also, and then a light bulb went off, and I was like, wait a second, it's straight relative to the earth, but it's not straight relative to the eyes and the lips. And since then, I've seen probably 2 or 3 patients where they've come and they say, look, my nose is deviated. And then we draw those dots, and the nose is actually kind of straight down between those 2 dots. And I tell them, I was like, if I straighten it, I worry that you're going to then notice that difference between the lip. And so we have a very serious conversation. Once she's pointed out to people, they're like, oh my God, I see, like a light bulb goes off in their head and they get it. And so what I tell them is that what I'll do is, instead of it being like very deviated like this, I'll bring it not straight, but kind of like halfway, in which case it's going to look a whole lot straighter to you. It's going to look normal to other people. But if we were to like look at it in a very objectively, say it's still not 100% straight, it's a little bit off, we're going to agree and say, yes, it's a little bit off, but it's nowhere near as deviant as it was, but it's also not perfectly straight. And that, I think, also looks the best.
Okay, so there is a solution for it. It's just not, you can't make it straight because the face is not straight.
What I will kind of tell people is that if, let's say, you're building a building, did I give this example last time? You're building a tall skyscraper, but the street isn't straight. It's crooked, or it's like, on an incline. One of the sides of the building has to be longer than the other to make the roof and every floor straight. And so it's the same way. It's like we have to choose where we're going to chew out some of the discrepancy. And so, doing maybe a little bit of deviating the bottom side of the nose is a better way to do that versus kind of like compromising on the front or the side.
That makes sense. More balance over
Correct.
straightness, really.
And it's a little bit like magic, like an illusion. Like, hey, look, the nose looks really nice from the side and from the front. But if you were to like look at it from the bottom, there's a little difference between the 2 nostrils. One's a little bit like, longer than the other, one's a little rounder. But you're kind of hoping that no one's really gonna come up to you, shake your hand, and like immediately look underneath your nose and say, hey, wait a second, your nose is a little different from the underside.
Thank you, Dr. Vranis. This has been wonderful. You helped us understand that crooked nose rhinoplasty, you really need to take in like balance over perfection.
I think that's actually the best tagline I've heard, and I might steal it from you with your permission. Is
You
yeah,
may.
we're achieving balance and harmony over perfection.
Beauty Seekers, we appreciate you joining us here for this interview with Dr. Vranis. If you like the education we're sharing, please subscribe to Beauty Seek.
Does your nose droop when you smile? Today, Beverly Hills-based Dr. Vranis explains what makes droopy tip rhinoplasty look beautiful or not. Stay with us to the end and learn the one thing that can make a nose after rhinoplasty look fake. Dr. Vranis, welcome. When patients complain about a droopy tip nose, What are they usually noticing about themselves?
Excellent question. I think there's two categories of people that complain about a droopy tip. One is that it's a hook nose that just is drooping 24/7. And then the other category of nose is that the nose is actually straight, but then when they smile, the tip hooks down. And so, or it's a droopy tip on animation. So I think those are the two types of people, and you have to figure out or clarify with them, when does it bother you? Is it bothering you at all times, every time a photo's taken, or is it only when you're smiling that then you start to really notice it, or it gets worse when you smile?
Beautiful or not, planning a droopy tip rhinoplasty based on how the nose looks at rest.
I think you need to assess it both at rest and in animation because we're animated. Humans are animated. We're social creatures. We're talking, we're smiling, we're laughing. And so, if you make a nose perfect when you're stationary and then it's like ugly when you're laughing, no one's gonna be happy. So I think you really have to consider both. And I think also the nose is a dynamic part of our face, and so it changes the proportions relative to other features, the position of the tip to other features when you're smiling versus when you're not smiling will give you insight as a surgeon as to what you need to correct. Sometimes it's a structural problem, so something like cartilage, which is always like there and fixed. And then there are little muscles in the columella, this middle part of your nose, that when you smile, it pulls down on the nose. And so sometimes you have to address those during surgery. And the only way to really figure that out is while you're doing the consultation, one, you're talking to patients before surgery of what they're hoping to achieve, is that you pay attention to these little differences. And then that also helps you make your surgical plan.
Beautiful or not, planning a droopy tip rhinoplasty without watching the patient speak.
It's kind of tough to do that. And so surgical planning, I think for the astute surgeon is you want to see patients at rest. You want to see them when they're smiling. You want to see them when they're speaking. Really be observant as to how the muscles and the dynamic aspects of the face will change the nose position. And therefore, it really helps you formulate your surgical plan to address the different issues that you see and that how your changes are then going to affect the ultimate outcome after surgery.
So it seems like to counter a droopy tip that you would just want to lift the nose so it stays higher during, life. Would that be a beautiful approach or not?
That's probably like the workhorse of rhinoplasty, of tip positioning, things like that. But that only gets you kind of, I think, like 80% of the way. The other 20% is going to be based on a couple things. One is going to be that muscle that pulls on the tip every time you're smiling or talking. And then the other thing is the dynamic interplay of soft tissue strength and scarring after surgery. So it's kind of like shooting a moving target for rhinoplasty because there's such a powerful scar force that you're dealing with after surgery. And so you have to account for that. You have to solidify the tip, make it structurally sound that it can withhold a lot of those forces early on during the healing process. And then also it will maintain its shape and position for, the test of time. So, you want to make sure that it's a lasting you know creation and structure that you're doing. And with age, we're all the noses are going to start dropping a little bit with age. And so even after surgery for the next 20, 30 years, there's aging component, aging force that will rotate it down a little bit.
Beautiful or not, a tip position that starts showing more nostril after surgery.
There's most women will want a little bit of tip elevation compared to men. Men prefer a much straighter and it's a more stronger masculine feature. It's a little bit more refined, elegant, feminine to have a tip that's a little bit more upturned. Now the problem is if it upturns too much, one, the nose looks shorter because now the distance from the tip to the forehead keeps getting like if you put it all think about if you put the tip all the way up in space, then like it would look like a really short nose. And then from the front, it looks very piggy. And I honestly don't know who came up with the term piggy, but I guess it's because you can see right into the nostril. So when you're talking to someone and their tip is too high, you're like looking right into their nose. And so a lot of patients come in actually very scared of that. And they say, "Oh, doctor, I want it higher, but I don't want to look piggy." And so that's where then again that rhinoplasty is so tough because 5 degrees more of elevation and you get that piggy appearance. Not enough elevation and you get a dissatisfied patient. So you really have to hit that sweet spot.
Okay, beautiful or not, a rhinoplasty result that photographs beautifully, but just feels really different in motion.
I think it's there's a difference between photographs, videos, and then in real life. And a couple of the celebrities and people that are on TV all the time, I've had this conversation with them where the TV actually fishbowls a little bit. The camera itself makes the middle part of your face a little bit wider, the appearance of it, just the way the lens is structured and the physics behind it. And so we kind of have to have a discussion and say we might err on the side of making it in person a little bit sharper and narrower to prioritize what their goals are, for their livelihood, for their industry, is on camera for it to look, more perfect or better or like, more a little bit more beautiful. But there is a discrepancy between that. Photographs, again, same thing. Photographs, if you can really adjust and play with the focal length of a lens, and you can make the nose look bigger. You can make the center part of the nose look bigger. You can make the rest of the face wide look smaller. So in proportion, the nose looks massive. And there's a lot of, unfortunately, on social media, you do see a lot of these before and afters where the before is taken with a lens that has a focal length that distorts the middle part of the face and makes it look huge, and then the after is shot in the reverse where it actually artificially shrinks the middle of the face. And so a lot of these before and afters are exaggerated, and some can even be completely manipulated and faked, to the point where a good friend of mine did this experiment where he took two photos 5 minutes apart. Obviously, no surgery was done in between. And you put them next to each other and you say, "Wow, what an amazing before and after!" Like, "Oh, that nose looks so incredible. What a magician you are as a surgeon." And it's not. It's all pure lighting tricks and camera angles.
Beautiful or not, a nose that keeps attracting attention during conversation.
I think there's some peer personalities that like that attention. And then I think the majority of the people would want to just fit in and, they want the compliment. "Wow, you look beautiful. You look great," but not necessarily, "You look like your nose is done." And so I think this is again just the society, the part that we like, everyone wants more natural appearance. We're trending towards more discreet plastic surgery, even though we're talking about plastic surgery more. People are more, honest, and I think they're more willing to share, "Oh, hey, yeah, I had my nose done." And then the person says, "Wow, incredible, looks so natural, fits you well." And then they just move on. They both move on with their lives and they never talk about it ever again. So it's an interesting phenomenon. I think most patients are more open to discuss plastic surgery, but they also want something that's more natural and less stand out. And you can kind of see this. I'm going to kind of is something different than noses, but talk really briefly about breast implants. If you look at the average size of the implant that was, put in 10, 15 years ago, it's notably bigger than this average size of the implant that's being ordered or put in today.
Okay, the answer to the question we've all been waiting for. You shared that there's one dead giveaway that instantly makes a rhinoplasty smile look fake. What is that?
So many times after a rhinoplasty, the nose, the tip is very stiff. And so when you're smiling and there's absolutely no motion to it, you can usually tell that that nose has been done. Also, oftentimes when you smile, and because the tip is so stiff, the muscle there will almost wrinkle against the nose. And so you end up with this little line right under the nose. And so that is another giveaway. Very rarely do you see that naturally occurring, but you do see it not infrequently after some rhinoplasties where they've put too many struts and stiffened up the columella way too much.
Fascinating. So the tip of the nose just doesn't move when you smile.
Correct. And then this here, there's like a little wrinkle, like a curtain. When you smile and you see that line, that kind of
Horizontal
comes
or
up.
vertical?
It goes horizontal. The line is horizontal.
So, okay, when I was researching that, some people were saying, I don't want a nose that looks designed, sort of like the reason my son won't get, his deviated septum addressed is that's the designed giveaway.
The designer nose typically means that it's a very pointy tip. It's a very refined diamond, this like super triangulated tip, and then like a curved dorsum, or the side profile is very curved, and then the tip has has a very unique kind of appearance relative to the tip, relative to the dorsum. And so that's, I think, what a lot of people mean when it's like a very designer nose. Like it has a very aggressive, what we call a super tip break.
Well, thank you. This has been delightful learning more about droopy tip rhinoplasty. You taught us so much today, and we learned a lot about the questions that we should be asking. And
Thank you. Thank you for having me. A lovely conversation. And I hope that the viewers and listeners picked up a thing or two or a couple
absolutely.
words of caution.
Beauty Seekers, we appreciate you joining us here for this interview with Dr. Vranis. If you like the education we're sharing, please subscribe to Beauty Seek.
Does the end of your nose feel too round or too wide? Rhinoplasty may help refine and shape the tip of your nose. Today, Beverly Hills-based Dr. Vranis explains what makes rhinoplasty look beautiful or not. Stay with us to learn why some noses can never achieve that tiny, super defined look that is currently all the rage. Dr. Vranis, I think I have a bit of a round edge of a nose. Maybe that's the way we grow them here in Minnesota, but I'm pretty okay with it. My friend, however, in college, a beautiful girl, always spoke about her dissatisfaction with her large round end of her nose. It was almost comical. Is there a name for that type of nose?
So we typically will call that either a bulbous tip or a boxy tip. In general, it just means that the cartilages underneath are too far apart from each other, and it kind of creates like a tented appearance outside. And it lacks that real crisp definition that a lot of women will crave.
So when a patient comes to you with a bulbous tip or boxy tip and they say, I want a tiny celebrity nose, what kind of transformation are they really looking for?
I think in general, they just want the tip to be cuter. And that usually does mean trimming the cartilages, reshaping those cartilages. Now, there is a caveat, is that you have to also assess the skin thickness. And so, what I mean by that is that the cartilage underneath creates the structure, it creates the footprint. And you can make these things incredibly sharp, but if the overarching kind of covering, the skin is very thick, think of like a big comforter on a bed, you're never going to see the definition of whatever you created underneath. Versus if you created the exact same tip definition and then the skin is thin like a bed sheet and you put the sheet over top, you're going to see every little detail. And it's going to be this tiny, tight little diamond shaped tip that everyone craves. So the now, if it's too thick, you don't see shape. If it's too thin, you see every little irregularity. So the ideal skin thickness actually is kind of like Goldilocks. It's like right in between where it's thin enough that you see the shapes, but it's also got a little bit of padding where a tiny little irregularity, because you can't make both sides of the cartilage exactly the same. But those little irregularities are camouflaged because there is a little bit of thickness to the skin. So think of Goldilocks, too thick and you don't see anything, too thin and you see everything, you see too much, and then just right is perfect.
I've heard that a surgeon might need to remove quite a bit of cartilage to make that tip look less round. What are the risks with that?
Oh, that's a great question. And that's honestly one of the biggest reasons for a revision rhinoplasty that I see in my practice is that this initial surgeon took out way too much cartilage. And while it looked good for the first couple months, 6 months, even a year, it just, there's not enough cartilage and support. And then over time, it starts buckling in because it can't resist the forces. And you end up with this like very, what we call pinch tip. So basically, the tip is fine, but right next to the tip, instead of it being strong and triangular, it starts coming in. It can also affect breathing because that is what we call the external valve. So that's the entryway of the air coming in. So one of the things that patients will notice is that whenever they breathe in, that external rim buckles in. Two, they have trouble getting air in. And then three, just the appearance over time is like, wow, it looks like I just put like a clothespin on my nose and it pinched it.
What kind of questions could a beauty seeker ask their surgeon to make sure that, that doesn't happen?
Great question. So, one of the things is, okay, doctor, well, if we're going to remove cartilage to make it cute refined, how are we going to address the stability? And so, usually what I'll tell patients is it's like a club, one in, one out. So, when I take a little bit of cartilage out, I put cartilage in a different place to reinforce the existing cartilage. So, I repurpose it. I really don't kind of take it out and throw it away. I'll use that cartilage is so precious. And you only get one chance. Once it's in the trash can, you can't come back and reuse it. Then this is why for a lot of revisions we have to go and get someone's rib is because we need cartilage. And so when you have that precious perfect cartilage that's like it's been in your nose your whole life, you're just repurposing it, you're moving it around a little bit. I think that's the perfect opportunity to take something where maybe it's like wide, cut it in half, and instead of throwing the half out, you put it underneath, and now all of a sudden it's thicker. So the part that stays is thin, but now it's thicker, so it has support.
That makes sense. And I really get idea of like how kind of subtle everything you do is. And I
And
appreciate
how
you. Thank you.
thoughtful, it's subtle, but it's also every move has to be thought about for the immediate effect, but also for the future and how things are, we try our best. And who knows, maybe in 15, 20 years, maybe it needs to be, threefold. Maybe we needed to add an additional piece of cartilage. But at least in my mind, like I'm very convinced that I've thought about it. I'm pretty sure that this is like what's in the best interest. This is what I would do if one of my family members was on the table. I don't cut corners and say, oh, well, like, let's just toss this out. It's a little quicker just to get rid of it and, close it up and see and pray. Every move, every maneuver is, well thought out, well planned ahead of time. And so, during surgery, it just becomes the dance. It's like a Broadway play. These actors and actresses have been performing and practicing for months. And then when the show goes on and the curtain comes back, for them, it's just kind of like another day, just kind of executing what they practice. And surgery is the exact same way.
After surgery, is it typically beautiful or not to a patient to have a new nose tip and it catches the light, like with all of the visible edges, if you will?
I think whether you've had a rhinoplasty or never had a rhinoplasty, if especially in today's day and age where there's cameras, selfie mode, Zoom calls, ring lights, 5 ring lights, overhead lights, and we're just kind of looking at ourselves more than we ever have. You're always going to have good angles, bad angles, mediocre angles, favorite sides, not like less favorite sides. And so, I think whether you've had a rhinoplasty or not, you're gonna have some angles that you just like more than others, or there's gonna be one picture that it was taken from one side, the angle, the light was hitting you from the other side, it causes shadow. It looks like it's, there's an irregularity, or it looks like it's deviated, or it looks like it's too big, or it looks like it's too small. I mean, I think at that point you just say, hey, take the picture over again and move on with your life and not, save this picture, run to your surgeon and say, oh my God, look, in this one picture, it looked terrible. And then you look at it, it looks great in person. You take pictures, it looks good in pictures. You look at all the other pictures on the camera roll, they look great. And they're like, no, but that one picture looks terrible. And so I think at that point, you have to reframe and say, listen, like you're going to take some bad pictures. I'm sorry. I take bad pictures all the time.
Oh my
Um,
goodness.
it's just life. It's what it is.
Beautiful or not, post surgery, um, a nose that somehow still feels like soft, from a bulbous tip to kind of still feels soft, not overly defined, if you will.
I think that goes into the preoperative conversation you have with a patient. You look at where they're starting from, you assess what they want with their words, you assess what they want with some pictures in terms of they look at you or you guys go together through some photos that they say, this is what I want ideally. And then you have to figure out, is this achievable based on what they're starting with and what they have and what they want? And then you make a plan. And so I think if there's beauty in nature. Yes, it's beautiful to have like, a little like soft round, not like a super Rudolph big round nose, but like, just because it's round doesn't mean it's bad. It could be like small and round and cute. And so it doesn't always have to be this like tiny pointy nose.
Okay, our big question is about that tiny, pointy, ultra defined look. Is it possible that some bulbous noses can never physically achieve that look?
So yes, the short answer is yes. And some patients don't want to hear that. But the reality is that you can make the cartilage, the structure underneath super pointy, super sharp. But if their skin is thick and you lay that on top of this like very beautifully elegant pointy cartilage, from the outside, it's just going to look like a hump or like a hill. It's kind of like the thick cushioned comforter that you throw over. You can't see anything that's underneath all the definition. But if you had like a bed sheet that's super thin, then you'll see every little detail and every little pointy aspect of the cartilages. Um, so when patients come in, you got to like address that and talk to them and say, hey, listen, like I can make the cartilages super pointy, but you'll never see that definition the way your skin is. Now, there's certain maneuvers and tricks. We can thin out the skin a little bit to try to, make that comforter a little bit thinner. And it does work sometimes, but then sometimes your body just puts in scar. And so it re-thickens that envelope back up and you lose some of that definition. And so there's a lot of factors at play here that you're working with. To combat the scar, we'll do some steroid injections to calm that scar, thickness down. And so it's always a dynamic interplay between what you have structurally, what you're born with, phenotypically, what is in our, arsenal, whether it's a scalpel to cut things out, sutures to tighten it, steroid to thin things out, scar. We do some Accutane, we do some radio frequency microneedling treatments to like make the skin a little bit thinner. So we can try our very, very best, but at the end of the day, your result is going to be some culmination of all these variables, and you can't unfortunately control every single one as much as we would like to, as much as we think that we're in 2026. We've got the cutting edge medical care. There's just certain things where the body will react a certain way, and you can't foresee it.
So you can't necessarily look in your crystal ball and think, oh gosh, this is the type of skin that usually scars. That's not possible.
There's indications. And so highly inflammatory, like the acne prone patients, the ones that have rosacea, highly inflammatory skin, if they've got these big pores, that just it looks like it's like these little blackheads that go deep, right? And so that gives us insight when you study the nose closely. And this is what you tell patients, and you say, look, I see these four things. I have a very sneaky suspicion that no matter what we do, and I'm on board, I'll throw everything, I'll throw the kitchen sink at you, but at the end of the day, I think it's still going to be on the thicker side of average. Or actually, conversely, the other way, if it's super thin skin and you say, listen, like, I kind of hope your body puts a little bit of scar down to, pad things up, because your skin is so thin, you're going to see every little irregularity, every little edge of cartilage. And so it actually might not look all that great, or you might wish that it was a little bit covered or a little bit thicker because you see all these little edges of cartilage.
That makes sense. Yes, there's so much to consider. Thank you so much for helping beauty seekers who have bulbous noses or box tip noses better understand what the possibility is for beautiful results and not. And if not, it's really important to have that kind of a conversation with your surgeon.
I think at first, your first step, if it does bother someone, I think go talk to a qualified rhinoplasty surgeon, right? Like they don't go in and say, I want a rhinoplasty. Just say, hey, listen, I just want to talk. I mean, these are my thoughts. This is where my head's at. This is what I have. This is what I see. This is what I heard on this podcast. This is what I heard on this YouTube. This is what I heard at the Beauty Seek, channel. And so you get all this information from different sources, and there's no one better than just to sit in a room with for a consultation with a plastic surgeon, board certified plastic surgeon, facial plastic surgeon. Those are like the two top trained professionals in this area. And you find a good, honest one that, doesn't want to take your money and say, yeah, yeah, we'll do that for you. And then all the excuses come after the fact. Find one that you trust, that you think you're going to trust, they're not going to tell you something that you want to hear just because you want to hear it. They're going to tell you because, hey, from my experience, this will work. From my experience, these are the limitations.
I'm really glad you brought that up because how many consults are you averaging before someone decides they want a rhinoplasty? Is there some type of average or?
So a lot of patients now, with all this information out there, they know what they want, and they're actually very educated patients right now. Sometimes they're overly educated, and you have to say, okay, pump the brakes. Like this doesn't apply to you, or XYZ is going on, and you have a whole different set of, issues or things that we have to consider. So the consult is a little different now than it was probably 5 years ago, 10 years ago. And it's probably going to be even more different with ChatGPT, Claude, and AI and all this, information like at their fingertips at home. It's going to completely shift the way consults go going forward. That being said, I think my philosophy is that you got to meet me at least twice, minimum, if not more. We talk once, it's more of an introduction. We get a sense of each other. It's like a first date. We see like, hey, is there even potential here? For potential for you to be my patient and potential for me to be your surgeon. It has to go both ways. And then if like the answer is yes, then we go to like phase two, which is the preoperative visit, which again, you meet in person. We go over everything again, but in a lot more detail. That's where we really bring in those pictures that you want to achieve. We really talk about like, hey, this is doable, this is not doable. And then surgery is like a whole nother day. So that's three times that, like, I've seen you before. There's like, you're put to sleep and there's a knife, scalpel to your nose. That's my philosophy. And some patients want to go, they have an initial consult, they go see two other surgeons, and then they come back and they say, hey, wait, I have like 10 more questions. And then they're like, okay, now, yeah, I think you're the one I want to go with. And then we have the preoperative visit. So the preoperative visit is like after you've kind of said like, hey, you're the person I'm choosing. And so that's a separate visit, but you can have a first consult, second consult, a virtual consult, a third consult, a phone call, like, as many times as you need, because at the end of the day, I want you to feel comfortable that you've made the right decision. This is a really big life decision. That's just my philosophy.
I love that. I'm so glad to hear that there's more education happening. That's why we launched Beauty Seek.
And it's tough. I feel bad. I do feel bad for patients sometimes. Marketing has gotten really good. And so some of the best appearing surgeons and practices in any area, in Beverly Hills, in New York, in Kansas, and Texas, wherever, in Turkey, what you see is not always the case. And so, and I'm a professional. I can know what to look out for, but it's so well done and so well hidden. Credentials are often like hidden, or like, just kind of like move past the credentials. Yeah, I'm a cosmetic surgeon. Like, there's so many things, like these little things that a lot of patients, like most people in America or, around the world, you'd say like, oh yeah, it sounds legit, sounds credible, sounds great. Yep. The website's great, the Instagram's great, of course it's going to be great. And it's like not the case at all.
Do you think you could tell the difference if it was just a camera that was making a nose look better 2 minutes before a different camera lens was used?
Yeah, I think a well-trained surgeon can probably pick up on 90 to 95% of the tricks. Some tricks are so good, and this is again why I say I feel so bad for the patients, is that some of the tricks are so good that you can't even pick up on it.
Okay. So I wonder if one of the questions should be, what kind of camera did you use?
It's not just the camera. That it's how you set up the lights, how you dim the lights, how you like, do you backlight, do you front light, do you blow up imperfect? So, all these things that a lot of times even companies that are like billion-dollar companies show up to the office with a pamphlet and they're like, "Hey, buy my product. Like, look how amazing these before and afters are for a laser, for a cellulite treatment." And you look at it and you say, "Are you kidding me? Like, this picture's dark. This picture's backlit. This picture's front lit. Front light is going to take away all the shadows and blemishes and cellulite. Like, it's like this tells me nothing about your treatment." And this is like a published, marketing tool from a billion-dollar company that you'd think has one access to good before and afters. You'd think if you're trying to sell your product, you're gonna like pick like the best before and after, most standardized, most truthful and honest. If your product really works, and you're gonna put that on a pamphlet and then go around and like sell it. But even these companies come show up. I'm telling you, these brochures are like half of them. You laugh at.
Yeah. I interviewed Dr. Zachary, and she said in her education, they were trained how to take before and after photos, never do table photos, always have the same lighting, have them the same distance. So it's truly, the most accurate picture. And so that was part of the schooling.
Oh, it's part of all our plastic surgery residency training. And that's why if you go you go to a plastic surgeon that's board certified, they're not only are they trained on doing it, but even during the oral examination is a huge component. The photography is a huge component of your oral to pass your boards. Photography is massive. But that's a different thing though. Just because you can do it, actually, it's almost counterintuitive, or not counterintuitive, but it's almost like here is like your weaponry. Become a master at it, and when you have greed and unethical behavior fall into the picture, you use these, how to manipulate the images, and so you do it in your favor in a way where then you trick the public and you trick patients and things like that. So it's actually, I would say, yeah, these institutions have trained us, and it's an expectation that how to do the before and afters. But some people get greedy and they use those exact tools to make things look more better, or they make it look more unrealistic. They make it look like the wow factor, the shock factor, because that's what's going to go viral. That's what's going to boost their practice. And so there's a lot of greed out there that's manipulated and fueling some of the manipulations. It's unfortunate.
It is really unfortunate, but now you inspire me. I think we're going to have to do an interview where we can kind of show here's what you should be looking for in the before and afters. And now with AI, it's only just going to increase.
Absolutely. I think a couple of years ago, one of my mentor's patients, her husband was a forensic photographer or something like that, and went around and looked at, I think like 30 different websites from, surgeons. And of the 30, I think like 20 of them, some insanely high number, were like digitally manipulated.
Okay. Thank you for sharing this. This definitely, we have to explore and investigate this further. I appreciate you. Thank you.
I'm giving you some fuel.
I love it. I love it. Thank you for contributing again. Returning champion, Dr. Vranis, Beverly Hill based, board certified. And we appreciate all of the knowledge you brought to us today about bulbous and crooked,
droopy tip and the crooked.
Droopy tip. Thank you. Rhinoplasty. Appreciate your time.
Thank you. Thanks for having me. Till next time.
Thank you.